If I could ask a follow-up question to what Per just said. We met with Dr. Coffey earlier this year, and one of the things we talked about was like those patients out there in Ireland that are being treated by some doctors or consultants. They know nothing about a national system. Everybody here knows there's a national system, but what about those patients that do not know? And has anything happened on that, or what can we expect on that?
So one thing that I haven't mentioned so far, but is worth bringing up at this point, is that the Department of Health Minister Harris will publish a third National Cancer Strategy in the coming months, and I would expect December, more likely January. In that there'll be a lot of content, and most of it will not be particularly surprising. It'll be scaling up the cancer centres, there'll be new focus on survivorship that Justin covered earlier, there'll be talk about molecular diagnostics, genetics, etc. But there'll be a list of recommendations, and from the draft I've seen, at least 2/3 of those recommendations will fall to the NCCP to implement. I think the opportunity there is to say, right, we have 8 designated cancer centres. They cannot all do everything. Within that, we need to actually formally specify which centres do not do the following, or conversely, which centres do the following. I think the way we would make that happen, apart from issuing kind of formal correspondence to hospital group CEOs, actually say, you know, we're going to type funding to this. If you find that you're doing cancer surgery for neuroendocrine tumours and you're not a centre with significant volume and expertise and recognition in that area, you will not be funded for that activity. And I think what happens then is the CEOs and the chief financial officers in the hospital saying, right, no matter what the surgeons want to do in the smaller hospital that shouldn't be doing it, if it's not being funded, then it's not going to happen. So I think we have a few new levers that we're developing in driving change to put the activity where it needs to be. And I think that that's probably the best example I can think of for that.